your NCLEX video on your priority practice exam questions. All right, some of you took the last practice exam. You kind of see where you are, things you need to work on. Well, here's another one. All right, and these questions are just like the ones you're going to have on NCLEX, okay? So take out your pens and papers. We're going to start right now. Now let's go over our answers and see how well you all did. A nurse is beginning her night shift. Which patient should she see first? C. The client 1 day post-appendectomy with an abdomen that is rigid, because a rigid abdomen is an abnormal assessment. All these other guys can wait. Some of you may have picked A, But remember, we want our patients to use pursed lip breathing, so the patient with COPD is doing just fine. A nurse on a med-surg unit has just received a report on 4 people. Which patient should he assess first? That's going to be A, the 55-year-old with a blood pressure of 130/89 who is suddenly confused. Why is this patient suddenly confused? Could it be a lack of oxygen? Yep, that's going to be our priority. Figure out why this patient is suddenly confused. Oxygenation is always a priority. So we have a CHFer comes to the ER. His blood pressure is 189/99, heart rate 101, respirations up at 28. His pro-BNP is greater than 35,000, and his ABG says metabolic acidosis. What is the priority? Our priority is B. We're going to put the patient on a low-sodium diet, but most importantly, the 2 liters of oxygen because this patient is in respiratory distress. So once again, oxygenation is the priority. Don't get fooled by all those other details. Number 4, a nurse enters the patient's room and notices that the confused patient pulled out the endotrache tube. Low pressure alarms are sounding. The priority action would be to set this patient up for re-intubation. You don't have long before that airway might collapse. So we got to get this patient ready for the process of re-intubation. Number 5, a nurse on a psych unit begins her shift. After she is given a report, who should she see first? That's going to be D, the client who is saying the CIA is telling him to cut the phone lines. This patient needs to acquire some sort of weapon to do this. Is he going to use a knife or scissors? Is he going to cut me or somebody else if I try to get in his way? We need to see this patient first. Aw, a nurse is entering the nursery. Which newborn should she assess first? That's going to be A, the newborn with his crib against the back wall. Temperature is a huge priority for newborns. They can't regulate their own temperature, so we always keep them warm. We don't put their cribs under windows or against walls. We make sure that their head is covered. So A is going to be the baby that needs to be addressed first. A nurse has 4 tough patients. Who should she see first? That is going to be D, the one with shortness of breath and a lower extremity thrombosis. Why is the shortness of breath? Has the thrombosis dislodged? Is it now a pulmonary embolism? Everybody else, shortness of breath is kind of part of the pathophysiology, but not D. We need to see this patient first, and then this nurse needs to get a new job. Hey, a follow-up question. So a nurse is working in a postpartum unit. Which mom needs follow-up teaching about accidental poisoning? That's going to be D, the mom who says, I will put the medications on the highest shelf. Well, toddlers can climb, so that's not going to be very safe. Everybody else is doing good things for their baby. Peritoneal dialysis, you got to know about it. Nurse just received 4 patients. Which findings should she report to the physician immediately? That is going to be A. This patient, even though they're resting quietly, they have a cloudy dialysate return. What is that about? May indicate infection. So let's see this patient first. Last question, who needs oxygen first? That is going to be C, the patient whose pulse ox reads 88%. That is a huge indication that the oxygenation is not adequate. Everybody else can wait. How'd you guys do? Pretty good? Did you feel like you were taking NCLEX? I really wanted you to. As far as answers go, if you've taken Remar Review, you should have gotten 7 out of those 10 correctly. 7, all right? If you haven't taken Remar Review, maybe 3 of those questions, and that would be where typically most students are. So let that be a study tool for you to carry on with your studying. Get ready for NCLEX, and I will see you guys soon. Bye-bye.